You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says that nobody should be wearing a loose-fitting denture. With us, we have actually Tulsa's go-to implant dentist, Dr. Chris Ward. Dr. Ward, welcome to the program.
Thanks, Randy.
I shouldn't just say Tulsa. You say you patients come from all over.
Yeah, they really do. Tulsa has about 1 million people around it, and what we found is there's not a lot of doctors that offer this kind of care in our area, so we probably have a 4-state draw from Kansas, Arkansas, Texas, and so it's very busy, very fun.
Now, in your practice, I guess how dental implants are typically done, or you go to one place that does the surgery, another place where they put the teeth on top and maintained elsewhere. You do both parts.
Yeah.
Is that why you do it so quickly?
It is why we do it so quickly, and it's why we can control some of the costs that are associated with that. But in our evolution of what we want to do from simple implants when we started 20 years ago. I mean, we've been doing this a long time, but technology has changed so much. Used to, we would have to involve a lab, all these goopy impressions, stone, just a more difficult procedure, where now technology's brought us to where we can do everything digitally. We can bring in cone beam CTs and marry all these images, but at the end of the day, now we're able to give patients everything in-house, where they don't have to go to a surgeon to place the implants, a imaging center to get their CTs, a lab that we have to involve. We cover all of that in-house.
You told me, I think you told me,
yeah,
that you're printing their teeth in the other room.
Right.
While they're there.
Right, absolutely.
Is that, so is this an exaggeration that somebody with no teeth, let's say a denture, on the day of the procedure can walk in with no teeth and walk out that day with upper and lower teeth that don't come out?
Every day, all day. That's what we do.
So that's common?
Yeah, very common.
Okay, good. Now, you brought a stack of photos.
I did.
We're going to try to get to as many of those, and I'm not trying to side with you. Okay. But I did flip through those photos, and these are dramatic. Very dramatic.
They are, and they each have a story, and with all of them, it's part of the most fulfilling part of my part in this process, is getting to see them, how they present, all their fears, their anxieties, things that have just held them back. It's almost like they don't make eye contact, they're ashamed, their hands in front of their face, and they always tell me, you know, you've never seen anyone as bad as me and all that stuff.
Okay.
And it's one of those things that it's like, no, literally, this is what we do every day. You just weren't aware of it. And
because why? Because they don't smile?
They don't smile, right? And those people hide themselves. They're not out. They're not. Okay. They're not going out, eating all the things, enjoying life. Yes, over and over.
Like they avoid going out.
Absolutely. Their teeth. And you know, you've seen the research in terms of how much a smile is sexy and what's part of their persona and what people think is attractive about people. And if that's not part of who you are, how do you go in the job interview or on the date or just things in life that fill you up, that make your experiences so fulfilling when you're just hidden? And that, by and large, the biggest consistency among patients is that they're just held back by it in one way or the other.
So who's the typical dental implant patient you see, if you had to categorize them?
There's really 2 primary categories. One, the easiest one, is they're in dentures. They've taken all their teeth out. They were told by the dentist, you know, there's nothing we can do to save your teeth. Really, dentures are your only option. So they go in, have all their teeth taken out, and they're just in these pieces of plastic that they live in, try and function in.
Okay.
And from the standpoint of self-esteem, you can imagine you're in a conversation and you've got this bulky piece of plastic in your mouth that tries to fall out on you at the worst time and doesn't feel right. Your speech is a little bit affected. It's a little bit bulky. Your skin doesn't look just right. But those patients, there's almost 41 million people in the United States that live in dentures. Of that patient base, there's a certain amount that are going to do fine with it, and you could put whatever in their mouth and it would work. There's a big percentage of those patients who can't function. They gag, they don't enjoy food, it's really a negative experience for them. So for those people who have dentures that are pieces of plastic, we give them a solution where we have teeth that we attach in their mouth, same day, come in surgery, start to finish, they'll be attached, beautiful smile, now they can go on with their life.
You say but these denture wearers don't come in. I mean, the last thing they do is come into a dentist, right?
Right.
They only go in for relines.
You're going to see in a lot of the stories, which I brought too many, I know, but you're going to see part of their stories is when I go to the dentist, I get hurt. every time my teeth are loose or they're just decayed or they're broken, and I have to spend all this money, and every time I do that, it's just a really poor experience. So they avoid the dentist. They don't want to go to the dentist. So they get to this point where it's like, I'm not gonna take care of them. At some point, I'm just gonna go to dentures, and that's where they end up.
Okay, now I interrupted. So the second group of patients you see that do this, or what?
So the second group of patients are the ones that have gone to the dentist that are now being told, really, there's not a lot of solution for you. You're gonna have to go to dentures, and they're terrified. It's like, they know their grandparents had to do that and their parents had to do that, and it's just this thought of, they saw the changes and differences in their family's life and they don't want to go through that.
But if your gums are bad, can you do this? I mean, aren't the implants more likely to fall out?
See, that's where you're wrong. We're going to clean all of that up. By doing what we do, the source of the problems, all these bad teeth, all the decay, all the bacterial infection, all of that we're going to take out and clean up and give them a new start, a fresh start. We're going to take all of that out in one appointment. They're going to be asleep. We've got a CRNA that puts them to sleep. They have no concerns. They're going to wake up to a new smile where teeth are attached, don't come in and out. Beautiful smile they've never had before. And it's crazy to see the expressions the day of. I mean, it's phenomenal.
Yeah, what's that like when they look in the mirror for the first time?
Yeah, a lot of tears in the room, me and them included. It's just, they see what they've always wanted to see in themselves, but they've just missed it. It just hasn't been an option for them. But to see, they'll lick it with their tongue and they'll just kind of start talking, and it's just things they didn't think were possible for them. And I've heard over and over and over again, it's the best investment I've ever done for myself.
Is that right?
Yeah.
So you brought some photos. What are we looking at?
I did. Okay. So
you had a big smile when you're showing me. I knew you were going to show these.
It's wonderful because these patients mean so much to you, and to look at where she came in. I want you to see this.
Oh, well, wow.
People like her, when they present like this, there's no amount of brushing, flossing, magical mouthwash, anything she's going to be able to do to get her mouth healthy. She's gotten to a point where she's been told dentures are her only option, and she's coming to us going, I hear there's another option. What can I do? Because I want to have teeth that stay in my mouth. I want to have that smile.
When you're in front of a patient like this, hearing their hard luck story, do you ever kind of, and they're going to do it, but do you ever get excited like, boy, they have no idea how good this is going to be? Does that happen?
Absolutely. And the thing, we share that with them. Our expectations for you are this, but until you experience it, it's really hard tangibly to give you that. They're so fearful of this whole process. Trust is such a big part of this. And so one of the things for patients like that is, how do they know you're the right person? How do they know that you care about them? How do they know they can trust you? And with these people, we go through, what's your situation? Tell me where you're at and what are your goals? And we're going to create a treatment plan to get you there. Okay, Randy, let me show you the after.
All right.
I want you to look at these side by side.
Oh, wow. Yeah, very nice.
And I want you to just imagine if it's the same person. I know that's hard to believe.
Yeah.
But look in her eyes how she's different. Look at, does this person look like she's more intelligent? Does it look like she's a person that, cares about herself, loves herself, is healthy? I mean, all of those things that, a picture says 1,000 words, but
she definitely looks younger. You know what? I guess, as you've mentioned to me, teeth make you look more attractive on everyone.
Right.
Looks nice.
Right.
She's got to be thrilled. So, how soon can they eat after they get their new teeth?
At the beginning, we're going to tell you take it a little bit easy.
Okay.
We want to be on a little bit softer diet, but before you know it, you're eating whatever you want. The apples, the lettuce, the things that you haven't been able to enjoy for years. Now you can eat what you want to eat.
So, like with her before photo, like she can't really eat chewy things.
She can't eat hardly anything. It's painful. Every time she eats, the gums hurt, the teeth are loose. Her life is debilitated based on her smile. So functionally, you talk about no more dentures and having to go to dentures. If she ends up in a denture, good luck in what she's able to eat. She's not able to eat the things that she wants to eat. An apple, broccoli, vegetables, things that are going to keep you healthy. She can't do that in a denture.
Do they come in skeptical? Like, are you sure, doctor, that I can do this? Like, do they come in somewhat hopeless, meaning they have no hope?
They really do. I would say We try very hard. If you go to our YouTube page or you go to a lot of the things that we're going to send you, we try hard to give you testimonials of actual patients that are telling you, this was my experience. Because I can say a lot of things and I can try and encourage you and help you, but it's what people have been through and gone through that speak to our patients. But 95% of them have no concept for themselves. They can go from here to here. They just can't fathom that.
How old, like what's your oldest patient? How old could you be to do this?
94 was my oldest patient.
Why would a 94-year-old want to do this?
You know, how do you know how much longer you have to live and what's your quality of life? She, again, biggest regret, I wait too long. This woman had waited 30 years being in dentures, but now her kids are seeing she's not able to eat and she's not living the life she wants to, and they're like, you can't take it with you. Go get this done, go fix it. And she's—
So 94 years old,
Yeah.
they're not more likely to fall out?
Absolutely.
These implants?
No.
So you're okay at that age?
Yeah, absolutely.
So 80 is young.
80's young, yes.
Do you ever have 70-year-olds that say, I don't know, doc, I'm old for this?
I have 60-year-olds that tell me that, and it's their perception. I mean,
Okay.
it's what they want for their life, and I don't. It's an investment for them. I don't want to spend their money. I know what it can do for patients, and we get to show them that, and we get to share that. The ones that go through it have never regretted spending the money for it.
Can they bite things like a carrot raw with their front teeth, or do they have to take it easy?
No, eat whatever you want in a natural way. Chew. I mean, it's those apples. It's that bite. It's that crisp crunch that you can't do in something that's moving as you're trying to eat, or when you're in pain, when you're hurting from teeth that are so bad.
What do they like more, the way it looks or what they could eat? What do you hear?
I hear probably the way it looks a little bit more, but to be able to eat and chew again, it's like a lot of these patients that we'll talk about, it's really, what do you want out of this? What's your why? And it's, I want to go eat a steak. I want to go have a Snickers ice cream bar that I haven't been able to do in years. It's those things that, it's the enjoyment. I mean, you want to live life, and you're just not able to do that when you're held back.
Okay, let's take a look at some more.
Okay, here's another one, Randy, I want you to look at.
All right.
Can you imagine people like this in his situation trying to eat almonds or trying to eat a good diet, or when you smile, half of your teeth are gone and the teeth that are left, they're broken, hurting, decayed. This situation we see every day. This patient drove from 7.5 hours away just to come see us because he had done his research. He had looked to see what the quality was that he wanted, timelines, everything that's in place, and it was important enough for him to drive that far to come see us. But his story was, he had been through some things from a medical standpoint that caused him to begin a process where his teeth just started failing on him. No, that's the thing. A lot of patients feel guilt, feel embarrassed about their situation with their teeth. So many times it's genetics. So many times it's bacterial. So many times it's stuff that they really don't have a lot of control of. And now they're in a situation where I don't want to even put myself out there and be vulnerable and be embarrassed about where I'm at.
So it's even embarrassing going to the dentist.
Yes, to even come in to try and get treatment. They're just embarrassed about their situation. So he was one of those guys. He didn't want to be seen. And so I've got to show you this. This is, and just look at the joy in his face.
He does look happy.
Yeah, and he was the one that really challenged the functional ability of these teeth. He wanted to know what he could eat. He wanted to know, can I chew ice? Like, you don't want to chew ice, but go for it if you want to. But these teeth are so strong, the zirconia teeth, they don't break. When they're designed properly, when they have enough space and distance and all the things that we work into these final restorations, I'm not worried about them breaking. And by the way, if they could possibly break, we have them guaranteed for at least 5 years.
Okay.
So it's one of those things that I have yet to see one break.
And none of these you're showing me are snap-in, snap-out teeth.
Great.
You're not a big fan of
Great
those,
question.
you say. Why?
Well,
Because it's less money.
because the patients don't like them.
Okay,
Those are the ones
okay.
that I have to repair, replace. You know, it's still a denture at the end of the day.
All
You
right.
still get food content. The implants help hold it in place. They kind of replace the glue. But if you spend just a little bit more, and you could have teeth that stay in your mouth that don't come in and out, natural feeling teeth, it's just, I'm not a big fan of it. If you're early on in the learning curve, if you're trying to provide this care, those sort of things are where you dabble in implants, and that's
snap
okay.
in, snap out.
Snap in,
so you
snap
did them
out.
like 20 years ago.
Yeah, right. And they are they are a service. The glue's horrible. If you've ever seen the denture glue and people trying to clean that out at night and keep things healthy so that you don't get fungal diseases and all of that, Cleaning dentures is no fun. So to get rid of glue, it's an advantage, but it's still a denture. And a big portion of our patients are transferring from that removable situation to go back to more natural
So if a
teeth.
snap-in, snap-out person is watching this, you could convert them to
Yes.
upper and lower teeth that don't
Big
come out.
part of what we do, yeah. And it's a misconception because you think it's implants and it's teeth, so it's the same thing. It's a removable denture. I mean,
Okay,
still
good.
plastic
All
teeth.
right.
Let me show you this next patient.
All right.
This is the patient. She comes in and her big joy in life is singing in her church choir.
Okay.
She loves to sing, great voice, but she's embarrassed about her smile. That's her biggest negative. She is a person, when you meet her, full of joy, but hands over her mouth, always hiding that. Her option would have been a denture. Can you imagine a person that loves to sing in the choir? Now she's got a piece of plastic that has to stay up while you're trying to sing, your tongue's hitting it. It would have changed her life forever. She couldn't be who she wanted to be.
Okay.
So her husband brings her in and he's like, we've got to help her. So look at
This
where
looks
we're
good.
at, right? These are like natural teeth that stay in her mouth. She says she sings as well or better than she ever did, but she's not self-conscious about it. She can lead the choir. She can be out in front of people and be the person she wants to be. I'd like you to look at this after one more time.
All right.
If you look at certain things, think about where her teeth are in relationship to her lower lip line. Think about the anatomy of her teeth. They're
They
not
kind of fit
just
perfectly, right?
square chiclets. Right. See the soft tissue, how her lip follows and looks so natural. Those sort of things, those aren't by accident. We have computer technology where we overlay the x-rays and all these digital imaging and scans so that we can define exactly how her teeth should look in her face before we ever design it and go to finals. But how natural does that look for her? Does that look like that belongs in her mouth?
I take it back. I told you in the green room that I could spot fake teeth walking down the street. Yeah. So this looks good. I'm not trying to side with you. But so again, this is computer driven.
Right.
You call it digital workflow.
That's right. That's
so
right.
it's pre-planned.
Pre-planned.
Even the teeth to their face.
That's right. And so by taking all that information, we can combine all that information, and just like you said earlier, we're actually designing it, printing in the office while we're doing the surgery. After the surgery, we're putting these teeth in. And the nice thing about it is, once I try all those in with the transitional teeth, if there's any minor modifications she might want or I might want, with the computer we can go through and change all of that to get exactly what we want for her teeth.
You know, she looks dramatically different, by the way.
Right.
I mean, all of these photos look dramatically different.
But could you tell me those weren't natural teeth?
No, they look like just great
Right.
teeth.
It's phenomenal.
So she probably gets a lot of compliments, and then she starts doing selfies. Will probably be the next
She
step.
does, and then when you start seeing her in the office, she just has more bubbles. She's just happier. It's just
good.
That's one of the most fulfilling things, because a lot of times, changing smiles, transforming lives. That's one of our positioning statements.
Okay.
It's really a misnomer. It's really not said accurately, because
What do you mean?
I think what happens is we may be a vehicle to help them get there, but they've got to make that choice for themselves.
So they'll say, "Doc, you changed my life."
Right. And
but maybe
I'm a part of that, and I think we're a part of that because
okay.
we're the vehicle to get them there. But if they don't choose that for themselves, because again, you're a person that has to be vulnerable. You're a person that has to get outside the comfort zone. I already don't feel good about myself, and I already have all these thoughts and feelings, and I must be the only one. And then I could show you hundreds of patients constantly that you're not alone and that we can help you, but it's a matter of you made the decision for yourself. And then I think the transformation part happens when a person like this goes outside and they look like natural teeth. They're different. They're happy, and they get feedback. They're checking out at the grocery store and they're like, "You have beautiful teeth," and it's this reinforcement that now I can smile a little bit bigger, and now my cheeks are a little bit sore from smiling so much, and all these things that happen. And at the end of the day, this reinforcement, their life has just changed. So it's all
Very
part
nice.
of a big
Very
process.
Nice.
But
very nice.
let me show you this next one.
All right.
This patient, our age range for patients
young.
can be different ages, and there's different things that affect them. This particular patient, she was the youngest of 9 children. She didn't get to go to the dentist until she was 21. So her family couldn't help her get to the dentist. When she went to the dentist, it was a horrible experience. Okay. It was very shame-based, very painful. All the terror and horror stories you hear about dentistry, that's what she experienced. So after that experience, she was too scared to go back.
So she was headed for a denture.
She was headed for a denture. And again, when I see this person, I can see what her final will be. And it's just phenomenal.
You see the end result.
I see the end result, and I'm like, she is a gorgeous person, and I can't wait to help her. She was waiting to be married. She had been engaged 2 years. She didn't want to stand up in front of people. She didn't want to be seen. So she's holding off her life because her teeth are so bad.
So what did you do?
So let me show you.
Oh, wow.
So
Very nice.
look at the difference. Can you imagine?
Yeah.
And it's obvious now, this person, but talk about tears shed. Pretty much every time I see this woman, we're both crying. She got married. She's having the time of her life, but look at the beauty of this woman that she couldn't see before. It's just, and I have so many to show you. I really want to just keep going.
And,
I know
and we are short on time, so I'm going to rush you a little bit.
Okay.
But this is good stuff.
You know, again, a guy gone in every time. He's got root canals. He really had no other option but dentures. His teeth hurt when he ate, and he didn't really even know this was an option. Heard about us, came by and saw us, and look at him. I mean,
He's looking good.
just the way he should. And tell me you can't tell those aren't
Wow.
natural teeth. No one's going to see him and go, yeah, who did your teeth for you? That's just not a common experience for our patients. But living his life, again, man, I want to show you.
Unbelievable. So I mean, and this you're saying is common to have teeth that bad, because I don't ever see them.
Hundreds and hundreds
because they
of
don't smile.
patients.
You're saying
They don't smile. They don't want to be seen. 40, almost 41 million people in the country are in dentures. Do you think most of them want to be in a piece of plastic? And it's not a lifestyle they want.
Okay.
They just don't know what their options are, or there's obstacles holding back. And my encouragement is, believe me, this can be you too.
it's very nice.
One more?
Yeah.
Okay. All right. So you see her. I didn't notice what her smile looked like until we started doing diagnostic photos and information, because she wouldn't smile. It was
that right?
so painful, and she was so embarrassed about how her smile was. And now she's one of the most bubbly, laughable, fun, energetic, can chew, be healthy. Her option would be a denture. And yet look at the result that she has. She has implants
Looks good.
that hold these teeth in, attach, natural. But I want you to notice the nuances. The front teeth, they're just a little bit longer. The embrasures, the little pink triangles, everything is symmetrical, and computers help us to generate the exact shape, size, teeth of exactly what she should have. And you look at it and it's...
Now the technology you have, like this in-house lab, would you say less than 1% of all dentists have this setup that you have?
Start to finish, I would say less than 1% is probably an accurate number. Most surgeons have to involve a prosthodontist, or if they do both of those, to control the lab part and the design part. There's a very small percentage of the surgeons, doctors that are in that realm. Let me show you another one, Randy. Good guy, truck driver, has to have a tooth taken out everywhere. He has no options but a denture. There's nothing else he's been told, and he had no idea that getting a permanent smile that stays in your mouth was an option, and yet there you go.
Wow.
And the thing is, for a truck driver, how do I have all these appointments where I have to make this where I can get this sort of thing done? And now with technology, we can do procedures like this in 3 or 4 appointments, and he doesn't have to take off, and it's something that he can manage within his life. Versus 20 years ago, this was 30 appointments, 6 months worth of work. Is just totally different.
Now, somebody watching this, really bad teeth. If you had an opening in your schedule,
Yeah.
next week they could have new teeth. Upper and lower teeth that don't come out.
Absolutely.
Really? Okay.
Yeah.
Okay.
Starting over, just like I'm showing you.
Let's rush you on these, because
Okay,
these
okay.
are good.
Okay.
Oh, wow.
Before, after. Similar. Tell me that, are you starting to get the feeling that there's a whole lot more people like this that you just don't see, that you're not aware of? That's the thing that I think people don't know.
So these are brand new upper and lower teeth.
brand
supported by
new
implants
upper and
with her.
lower. Function great, eat what she wants. I got to show you another one. This guy says he got in fights all the time in grade school, broke all his teeth, had all
Okay.
these crowns. Now he has missing teeth, and we give him new teeth. Solid. This is one of the ones. He was the one that wanted to have the Snickers for his teeth. But
Oh, geez.
talk about a change. And he's a young man now. He had some personal
I mean, the guy
decisions
looks a
that got him
lot
there.
more handsome in the after.
He a lot more intelligent, A lot more, and this is the bubbliest guy. I mean, he wasn't afraid to smile at you before.
Okay.
He really wasn't, but now the feedback you get from someone, if you're looking like that versus looking like that, it's changed how people respond to him, so now he's even bigger. And
Do they tell you they feel judged by some people because of their teeth?
absolutely. Well,
Like
and
they're poor or unclean or whatever?
they do, and I think they judge themselves as harder than the people around them.
Is that right?
They're just a closed personality, and again, you get to meet them all.
But by the way, do you think this guy's life, I mean, I know you can't prove this, but goes in a different direction because of his teeth?
Absolutely, it goes in a different direction.
Yeah.
So if you're a professional and you're in sales or you're in front of someone and you're having discussions, and when you smile one way, I mean, it's just natural. It's human nature. If it's diseased and things don't look great versus, I mean, this guy's a handsome guy. He can do whatever he wants
Looks
to do.
good,
Right?
looks good. Time for one more.
Okay. He's in a situation where he's had crowns on all his teeth and they're all failing, and the dentist is like, you're going to have dentures, and he really doesn't think there's another option, and yet we've got other options. We can restore that and change that back.
Do they ever come in trying to say, like, well, I was told like it couldn't be done, or I was told this or that?
Yeah.
Do you get a lot of that?
All the time. And again, we've spent a lot of time in implant dentistry, and we've elevated our practice to the highest level that you can have as a specialty. There are times where there's really not a lot of bone, and where do we go for these remote anchorage? And there's different options, but at the end of the day, every week I would say I've been told by a patient, they say I can't, I just want to see if I'm a candidate.
Because they don't have enough bone.
Because they don't have enough
So
bone.
what do you do when they have very little bone?
We have to find the bone where it is. Used to
Like
we would
special
graft
implants?
everything.
Is it special
Special implants? Used to would graft everything. Took years. It took up to a year to wait on the bone. Now we find bone where it is, and there's specialized implants, particularly in the last 3 or 4 years that we have, where we can do the exact same thing. Where it's not we're waiting a year before we get you to the teeth. It's day of surgery.
So the days
we're
of bone
connecting.
grafting, heavy sinus lifting, as you call it,
Right.
that's like almost gone now with the newer implants?
It can be. There's choices, pros and cons, and we go over
Okay.
that all in their preclinical. But yeah, that's the thing. They didn't have options before, and now they do. And it's something where you ask, yeah, does that ever happen? Yeah, all the time. They tell me, I don't really have choice. The dentist says I have no bone. I've got to be in dentures, and it's just not the case.
It's very nice. We're out of time. What do you say? Somebody watching this, they've heard what you have to say.
Yeah.
But for whatever reason, they're afraid, they think they're too old, whatever.
Right.
What do you say to them?
I say, all of these stories, they have the similar stories as you, and I would say, give yourself a chance. Come in. It's a free consultation.
Okay.
Just come in, let's look at things, and let's see, what are your possibilities? And don't be the one that's holding your future back. That's what I would say, because I get to see the afters, and I want that. It's fulfilling for me. I love what I do. I hope that we can help them, and I hope they give us a chance to.
Okay, great. I want to thank you for coming on the show. Great
Thanks.
stuff. And if they want to make an appointment, do they go to the website or just call your office?
Either one. Call us, go to the website. You're going to talk to a team that wants to help you, that loves people,
Okay.
and wants to find a place for you so that you can get the solutions these patients
Great.
have.
I want to thank you for coming on the show. Good stuff.
Thanks, Randy.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.